you. Are you ready for your checkup today?
4-year-old Riker Gross is at Glasgow Pediatric Healthcare for his 4-year checkup, a visit that includes Go-Check photo screen. The screening, done annually until about the age of 5, identifies vision risk factors.
You look straight at me, okay? Look right here. Good job. So this can show like hyperopia, myopia, which would be like nearsightedness, farsightedness, which is different risk factors that it tests for. It's then sent off to the company that they read it and then they send it back to us. So this is like a preliminary result, then they send us a final.
We love coming here. Everyone is always so kind and helpful and caring, and they always know exactly what's wrong, exactly how to fix it. They know how to ease your child's fears if they're a little nervous about coming, and whatever they have to get done. We always have a good experience, and we're always really happy with our care.
Dr. Lynette Brooks, a fellow of the American Academy of Pediatrics, is a provider at the clinic.
These are the same kids that my kids are playing ball with, or that I run into these families when I'm just out eating out or shopping. And so I feel like it makes us, I don't know that necessarily that we care anymore, I'm not saying that, but we just feel more responsible for them, because these are our friends and our neighbors, and we see them outside of the office. And I think having those relationships has just made a huge difference in how I feel about practicing.
Dr. Brooks says the COVID pandemic is having a lasting impact on many of the kids she sees.
And so it has definitely increased the amount of anxiety that we are treating. But even in addition to that, we see children that were born during the early COVID stages that have really had no social interaction. And so now they're a couple of years old and they've had very limited exposure to other children. And so we see some developmental delay in those arenas. We also have kids who have, for whatever reason, have been chosen to be homeschooled during this time period to, decrease exposure to either parents or grandparents or maybe susceptible siblings. And those kids are suffering from some social delay as well.
So the clinic is trying new innovations to help its patients and families. Jessica Hood is a targeted case manager.
I work with our patients and their families to develop plans that will help them and empower them to be more successful educationally, socially, and reach their goals medically, whether that be with specialists or skilled therapies, those sorts of things.
There's also a brush, book, and bed program which promotes oral health, reading, and the importance of sleep, plus a Reach Out and Read program that helps families build libraries at home, and targeted obesity and dietary initiatives that focus on healthy lifestyle choices.
We feel like our kids at Cumberland Family Medical have an opportunity to get all the services that they could possibly need, and we're so happy that we can house so many of those under one roof. Children who come here, we feel like it's well-rounded in the things we give to them.
With the Kentucky Primary Care Association, I'm Doug Hogan.